Hey everyone, this is Will over at PTFinalExam.com, here to talk to you today about the FSBPT's new content outline updates for the NPTE administration beginning in January 2024. So a lot of you have questions about the FSBPT's content outline updates, why they occurred, what they look like as far as scoring, what that's going to look like. So that's what we're here to do today, is to talk about all of the updates and answer any of your questions that come up to help you get ready for the 2024 and beyond exam administration. So let's go ahead and dive into the content. We'll talk about a lot of the content that has changed, a lot that has stayed the same, and some of the design updates you can expect beginning in 2024. So just to dive in here, talking about the changes that are affecting the NPTE, you can expect that beginning in January 2024, you will see a change in the total number of items. Now, obviously, most of you are taking the exam either for the first, second time, whatever. You likely have not experienced the exam in any different format than this. But the point being that as you are preparing for the exam, there are some design changes that are coming your way. And that's why it necessitated an item number change. So we'll just go through it here for a moment. Beginning in 2024, the exam, the NPTE for PTs will now include 225 items total. So what does that mean? 225 items total. That means that you will expect somewhere around 180 items that are scored and 45 items that are unscored for that grand total of 225. Now, a lot of you probably have questions. Why are there unscored items on the exam? Well, that's simply because they use you as the test taker to test out some of the new questions that they'll be rolling out to future administrations. So it's all part of the validation process. There is no way to distinguish the unscored items from the scored items. And so therefore, you really just need to answer every item as if your life depends on it. But the point being that you'll have 180 items of scored items and 45 unscored items for that grand total of 225. Now, of this 225, up to 45 of these will be what they call scenario-based items. So scenario-based items, that simply means that they will give you a common scenario that you will answer 3 to 4 to 5 questions related to that scenario directly. And I'll show you an example coming up here in just a minute. But the point of these scenario items is to give the representation or the feel of a patient chart. And when I show you the example, you'll look at it, and chances are you'll probably be a little underwhelmed. You'll be like, oh, okay, well, that's just all of the data of a patient chart, and then I answer questions based on that. So in addition to those 45 scenario-based items, you'll have your standard 180 standalone items, and I have an example of that coming up as well. And that can include graphic items, video items, image items. There's lots of ways that they could present that item, or just a total text-based question. That's the example I have coming up here in just a minute. For the PTA administration, so the PTA exam updates, again, they reduced the number of questions to represent a total of 180 items. 140 are scored, 40 are unscored for that grand total of 180. So on the PTA administration, you can expect somewhere around 35 scenario-based items. So on this, again, following a very similar proportion to the PT exam, there will be 145 standalone items, all of that to include graphic items, video items, image, or just simple text items. So you can expect all of that on exam day. And again, these numbers are slightly variable. I'll show you the actual numbers here in just a moment. They are ranges, but this is just the general look and feel of the exam. So to give it to you at a glance, you'll see this, that for the 2024 and beyond exam administrations, you can expect for the PT content, they'll have 225 items, and the PTA content, they'll have 180 items total. So that includes, again, just looking down the PT column here. So for PTs, that includes 180 scored items. You have 45 unscored items, up to 45 scenario-based items. And that doesn't mean 45 scenarios. That means 45 questions related to scenarios. Typical scenarios include somewhere between 3 and 5 questions. So a solid handful of scenarios, 6, 7, 8 scenarios, depending on how many questions are associated with each one. You get the same 5-hour time bank. So that means you can use the 5 hours as you wish for the 5 sections of the exam. You could use all of your time on the first section or 2 minutes on the first section. They really just don't care. They want you to use that 5-hour time bank wisely. So therefore, my general recommendation continues to be 1 hour per section. The scoring will remain the same, that you need to have that scale score 600 out of 800. Now, a lot of you looking at that are going to say, well, does that mean 75% of the items need to be correct? No, it'll still be that same proportion. About 67% of the items need to be correct in order to actually pass the exam. So I get asked all the time, what is the target score I should have on practice tests? And very often I will tongue-in-cheek say, well, your target score should be 100%, right? They're like, no. What's the passing threshold is what they're really asking. And that passing threshold should be somewhere around 70% or higher in order to have a strong likelihood of passing the NPTE. So that still will remain true here, that 70% or higher on your practice tests will be an excellent indicator of passing on the actual NPTE. So the PTA content, again, follows what we just talked about. There will be 180 items total, with the scored items 140, the unscored items 40, and the scenario-based items up to 35 scenario-based questions. On the PTA exam, you get the 4-hour time bank for the 4 sections, and you still have to achieve approximately the same 67% or so. It is slightly variable, and that's why they use the scaled score, indicating that if there was an exam that was perhaps slightly more difficult, or an exam that was slightly easier than other exams, that scale score helps to equilibrate the exam attempts to make sure that everyone is on a level playing field. The cost is actually equivalent for PTs and PTAs. This is interesting. So $485 total, and those fees are subject to change. So if you're watching this, maybe in the future, for 2024, it'll be $485, but as time goes on, it only ever goes up. So just watch out for that. The prometric fee is about $100. Again, this is likely to change over time, but the current sitting fees are about $100 for PTs and about $82 for PTAs. Again, that is subject to change each year on year, as you'd expect. But as of this recording for that 2024 administration, these would be your general fees, the number of questions in each one, and what you can expect there. So the other things that you need to know about NPTE updates include the content updates. And so let's talk about PT content updates, and then we'll talk about PTA content updates. So PT content updates, what does this mean? This is what is likely to show up on exam day. And I'll show you the actual content outlines here in a moment, as well as some samples. So as far as your skill and knowledge requirements for the PT exam, you need to have, the biggest change here is that regenerative medicine. What in the world is regenerative medicine? Well, regenerative medicine would be medical interventions that would help to regenerate, so such as stem cell therapy, platelet-rich plasma, items or medications and interventions that are likely to improve or regenerate tissue. So we could be talking muscle, we could be talking cartilage, we could be talking tendon, bone. There's a lot of different avenues here. And honestly, this is something that is being added in a slow but steady trickle into the core textbooks. So I do anticipate this will only become more robust over the next 5 years or so. So that regenerative medicine related to interventions and prognosis for both the MSK and the neuromuscular system, as well as the provision of telehealth. Now, telehealth, anytime you have these non-systems or the professional responsibilities categories on the exam, it really is all about making sure that you are providing not only safe, direct, and effective care, but that you are satisfying the patient, the provider, and the payer source. So the triple P. You just want to make sure that everyone is satisfied with the interaction. So I would expect that to be the same for telehealth. You want to make sure it's a win-win-win for the patient, the provider or the PT, and the payer source. So some type of insurance agency or individual payer, whatever it is, you want to make sure that it's a win-win-win for all parties involved. Other activities that definitely need to be added to your list. Again, these are coming in a slow trickle into the core textbooks. So taping for edema management. So this would be like kinesio taping or the dynamic type taping, where you can manage edema that way. Electrodiagnostic test results, we're talking about electromyograms, EMG testing, ways to be able to determine whether or not a person has increased nerve conduction velocity, what the fasciculations or fibrillations indicate. Those electrodiagnostic test results are important for your intervention and prognosis. Gross, gotta make sure I spelled gross the right way here, but gross motor development. We're talking about pediatrics, and then negative pressure wound therapy. So negative pressure wound therapy or wound vacs. These are already somewhat tested, but they will continue to increase the number of items related to negative pressure wound therapy, more commonly known as a wound vac. This is where that negative pressure helps to offload the exudate from a wound. And these types of questions will certainly be included in the PT final exam simulator. You want to make sure to get a copy of that so that you can stay up to date with all the questions or the types of questions you'll experience on test day. Of note, items that were removed include phonophoresis for both work activities and skill requirements, as well as taping for lymphatic drainage. So this is again reference to dynamic taping. It does not reference the bandaging systems or the compression systems for someone with lymphedema. So lymphatic drainage techniques would still be required for manual interventions as well as compression therapy, but you would not need to know any type of taping for lymphatic drainage. So talking about the PTA content outline updates. So the PTA content outline had fewer changes. So they didn't particularly add a lot here other than gross motor development progressions. We're talking about pediatrics, but they did remove a number of things, including pharmacology for the gastrointestinal system, a lot of taping. You don't need to know nearly as much taping. You don't need to know non-selective debridement anymore, topical iontophoresis. These are all things that were removed from the skill requirements and work activities for PTAs. You don't need to know anything about phonophoresis. Well, I shouldn't say you don't need to know anything about it, but as far as testing requirements, you'll need additional training in order to have, or additional certification for taping, non-selective debridement, vestibular dysfunction, all of the ins and outs of participation in professional organizations. So we're talking about the APTA or any type of section of the APTA or the state boards of PT. Anyway, all of that's removed from the PTA exam, so you don't need to worry about that. All right, looking at the actual content outlines. So these are the actual, this is it. This is what is on the exam. If you look at this, you'll see that the grand total is 180, just as we described. And then looking through each of the body systems, you see the body systems in this left column, and this goes through cardio-musculo-neuro. These are the big three systems. So if you look at the big three systems, you'd see cardio-musculo-neuro have the heaviest representation. Of note, they, just as an FYI, they reduced the number of actual MSK questions, and then they added a few questions really just in a few of the other categories. But what they did is they took the heavy emphasis off musculo and dispersed some of those questions among the other systems. So we've got cardio-musculo-neuro, integumentary, metabolic endocrine, gastrointestinal, genitourinary, lymphatic, and system interactions. So all of these will have a handful of questions. And again, all these things are things that we address in the PT final exam courses. You want to make sure to get a hold of our latest course updates to make sure that you are up to speed in each of these systems, and including the non-systems, equipment, devices, technology, modalities, safety, protection, professional responsibilities, and everyone's favorite, research and evidence-based practice, talking about research terminology and research skills. All that's the PT content outline. So similarly, the PTA content outline, so now we're looking at the PTA content outline, looks something like this, where you see the grand total of about 140 items. But I haven't mentioned this yet, but you'll note that each of these, if you look at each of the systems, you'll see that there is a range of items that could occur in each of those systems. So it's not a guarantee or a set number, other than you are guaranteed to have that range of items on the NPTE. So for PTA content outline, this is more about data collection, the diseases and conditions that impact effective treatment and interventions. You see all three of these work activities divided across the body systems, and then also included would be the non-systems, very similar to that of the PTs, but there's just fewer questions in each of these systems and a lesser representation. These are always my favorite body system areas. 0 to 4 questions in gastrointestinal. So isn't that great? It could be 0 or it could be 4. So not a robust knowledge required here, but just a cursory knowledge of a variety of topics in, say, the gastrointestinal, genitourinary system, and same for lymphatic and system interactions. So, all right, let's go ahead and dive into an example here. We're going to go through a case study. This is a case study. This is a scenario-based item related to the PT exam. So what we'll do is I'll encourage you, if you wish, to stop the video here and review the case scenario and select an answer to the item. I'll give you a moment to pause that, and then we'll advance to the next question. And the next question, there are 3 questions related to the scenario. I would encourage you to take a moment and see if you could identify the correct answer in each of these 3 questions. So you've had a moment now to pause and look at the scenario. What I'll do is I'll just focus in on the question here, and then when we talk about the answers, I'll talk about what part of the scenario helps give you a clue to this answer. So which of the following measures is the most appropriate target aerobic exercise intensity? 60%, 80% of maximal heart rate, or Borg RPE 12, or Borg RPE 17? All right, we'll move on to our next question. Again, the same scenario, but a different question now. And of note, these questions don't build on each other. They are standalone items, so you don't have to get one correct in order to get the other correct. Rather, in this case, you just answer each item as a standalone item. So as we mentioned a moment ago, go ahead and pause the video, see if you can identify an answer. We'll just focus in on reading the question, and then we'll give the answers here in just a moment. So if the patient takes all of his prescribed medications at one point in the afternoon, physical therapy should be scheduled during which of the following periods of time? Physical therapy should be scheduled during which of the following periods of time? 30 to 60 minutes before the patient takes his meds, 2 hours before the patient takes his meds, 30 to 60 minutes after the patient takes his meds, or at least 2 hours after the patient takes his meds. All right, and our final question related to this scenario, again, I'd encourage you to pause it and select an answer. Which of the following assistive devices would be most appropriate for the patient to use when walking outside? Which of the following assistive devices would be most appropriate for the patient to use when walking outside? So we have number 1, the rolling cane, 2, quadruped cane, 3, four-wheeled walker, and 4, front-wheeled walker. All right, now that you've selected your answers to each of these, let's go ahead and talk about the actual answers and some of the ways you can dissect these case studies, or these, I should say, scenario-based items. So this first one, which of the following measures is the most appropriate target aerobic exercise intensity? So your most appropriate target aerobic exercise intensity is going to be 17 out of 20 on the Borg RPE scale. Now, why is that? Well, very similar to what the LVST big and loud therapy does, is that with Parkinson's disease, they tend to have a depressed or decreased movement, but also decreased cardiovascular response to exercise. And again, all this is related to amplitude of movement and amplitude of response to that exercise. And so therefore, when it comes to exercise intensity, you should push these patients beyond what they would, quote unquote, be comfortable with. It's kind of like, again, the LVST big loud therapy is all about how large of an amplitude of movement can you make? How quickly can you walk? How much can you push into this activity? And by so doing, you will be able to increase the amplitude of that activity. And the same thing for the cardiovascular response. You need to push, because these folks will have a blunted response, or a blunted or a lower heart rate. So therefore, you need to push them harder than what you would, say, an anatomic normal individual. 17 out of 20 being hard or very hard. That's the intensity that you're targeting in order to get an appropriate heart rate response. Now, again, if you look at just the heart rate, you'll find that that is a poor indicator of their actual performance. Just because of that autonomic dysfunction, their heart rate is blunted. Rather, you need to push into that exertion, try to push them to their limits. 17 out of 20 on the Borg RPE scale. You'll find that this increased intensity will result in better or larger amplitude movements, target whole body movements, and try to get a better cardiovascular response. And again, this is related to the presenting problem or the medical history of Parkinson's disease. So when you see Parkinson's disease on the list there, that should tell you that they have a blunted or a depressed heart rate response, and you need to push them to the big and loud therapy, the largest amplitude movements, the biggest, the widest, the most you can do with this patient. And you'll find that results in the best intervention. So this is back to the safe, direct, and effective interventions. So our next item here, if the patient takes all of his meds at one point in the afternoon, physical therapy should be scheduled during which of the following periods? So physical therapy should be scheduled during which of the following periods? Well, so we know that it should be scheduled 30 to 60 minutes after the patient takes his meds. That's because if you look at the Sinemet or carbidopa-levodopa, this is the most widely prescribed medication for someone with Parkinson's disease, and it reaches peak effectiveness somewhere in that 20 to 60 minute range after administration. So your best intervention strategy would be to have them take that med about 30 minutes before their intervention so they can be at peak effectiveness during intervention. So again, looking at these other ones, Celexa and furosemide are not particularly related to this case. Furosemide or Lasix, so clearly that's a diuretic. Those won't have nearly as much of a bearing on this question as the carbidopa-levodopa does. And so you want to make sure to exercise during peak effectiveness of the Sinemet. Then finally, the last option here, last question here is which of the following assistive devices would be most appropriate for the patient to use when walking outside? Well, in the case of mild to moderate disease, which we see here, this person had one recent fall, they've got Parkinson's disease, and they do have a timed up and go that's a little bit slow. We would expect it to be below 10, certainly below 20. In-block turning without assistive device, meaning that they don't twist their trunk. They're moving in a very shuffling pattern. Freezing of gaits, they have a relatively low Burke balance scale. All of that tells us that we're probably in the moderate phase of Parkinson's disease. And anyone who's in mild to moderate disease, really any type of wheeled walker is going to be hazardous because it will encourage them into further forward flexion and likely increase the risk of falling. So therefore, walkers with wheels are particularly hazardous. You would want to select the quadruped cane, especially that if it's positioned at the appropriate height or maybe slightly higher than what you would typically do, help hold them into an upright posture and decrease the risk of falling, or at least forward falling, in order to give them an appropriate assistive device. So when it comes to assistive devices with Parkinson's disease, you'll want to avoid wheeled items just because the risk of that festination, and it's going to roll away from them and they'll go into full forward flexion, which will increase falling. And then all things considered, they have difficulty initiating movement. And so with that difficulty initiating movement and turning, that walker almost gets in the road. Now, granted, I have seen patients with Parkinson's disease with a walker, but typically that's for just extremely limited movement. Their caregiver is helping to guide the walker. It requires a lot of assistance. So your best bet, mild to moderate disease, would be to have some type of cane or even walking poles. If you needed a bilateral hand device, use like walking poles or trekking poles. I've seen that used in patients before very effectively. Again, the goal being to hold them in a full upright position. All right, so that is our scenario-based item. And for PTs, PTAs, it'll be extremely similar. You'll have this patient chart. It's not all in full, complete sentences. It's not in paragraph form. Rather, it's in what you'd experience like in a SOAP note. So SOAP note where you got subjective, objective, so subjective, objective, assessment, and plan. That type of a note where you can see, all right, we got the plan of care, the examination data, past history, all that adds up nicely to be a patient case or patient scenario. All right, and then moving on to some of the regenerative medicine type questions. So this is an example of a PT-based regenerative medicine question. Which of the following statements best describes how applying platelet-rich plasma, PRP therapy, to athletes with hamstring strains may impact an athlete's future participation in sport? So which of the following statements best describes how applying platelet-rich plasma therapy to athletes with hamstring strains may impact an athlete's future participation in sport? So PRP would decrease tissue healing time, resulting in less risk of recurrence. We've got increased tissue healing time, resulting in a less risk of recurrence. Then we have kind of a mix and match here. Platelet-rich plasma decreases tissue healing time, resulting in greater risk of recurrence. And platelet-rich plasma increases tissue healing time, resulting in greater risk of recurrence. So I'd encourage you to take a moment and select an answer to this question before we continue on with the video. So when it comes to regenerative medicine, platelet-rich plasma is effective. So as you imagine, it's platelet-rich plasma. So you take plasma, you enrich it with platelets. And that the idea with this regenerative medicine is to increase tissue healing by decreasing tissue healing time. So you're going to speed their recovery, so decrease tissue healing time. And by so doing, you're also adding more supportive structure, collagen structure to the hamstrings, the hamstring tendons, resulting in a lesser risk of recurrence. And that's the goal with platelet-rich plasma, is that you're trying to increase or improve tissue healing in order to, number one, decrease healing times, so speed their recovery, and number two, prevent or decrease the risk of recurrence by increasing tissue strength. And so that's one of the goals of regenerative medicine. This is a regenerative musculoskeletal question talking about platelet-rich plasma. All right, so there you go. That's in a nutshell, maybe a rather large nutshell, but a nutshell talking about what changes are coming to 2024 NPTE exam administrations. Those of you who are curious about how they decide what the proportion of questions are, it's really based on a practice analysis. So that they take a very broad survey of the entire practice of PT and they assess what is required. And by they, I mean the exam administrators survey clinicians across the country, across the practice continuum, so new clinicians, old clinicians, across full diversity of not only the clinician, but also of practice scenarios, or practice settings, I should say. And they survey and determine what is most likely to show up for you as a PT newly out of PT school within the first year. So a first year practice PT, what type of content is likely to show up for you in the clinic, and that's what's represented on the NPTE. So in case you're wondering how it's determined by your peer PTs across the country, and it changes every 5 years just because the practice of PT is ever evolving. So that's why the FSBPT will update their content outlines every 5 years or so. So just of note, as we come to a conclusion, be sure to check out the NPTE podcast. It's a totally free way to study. We go through a lot of practice questions, a lot of cheat sheets we give away over on ptfinalexam.com/podcast. So be sure to sign up for our list there to get our freebies. Also find out about all of our newest offerings and updates and new courses as they come available. Be sure to check out everything over at ptfinalexam.com. Hit all the buttons, like, subscribe, share, whatever it is. And I'll catch you all in the podcast. So take care, everyone. Talk to you soon.